Dr. McQueen joined us about 3 years ago as a psychiatrist on our adolescent acute unit. We quickly realized his leadership skills, his educational skills, and really saw him bring a department together as a team. He really focused on how can we provide the best care possible for those that are here with us and engaging family within that treatment.
When I first got to Riverside, I was a child and adolescent psychiatrist, and then after about 3 or 4 months or so, they approached me about becoming medical director of Child and Adolescent Services, and then from there continued to talk to Stacy about her vision for Riverside Behavioral Health and how she wanted the facility to grow, and how the main hospital and administrators there wanted the facility to grow.
We've always had behavioral health as a part of Riverside. It has always been something that has been important to us, but I think with the pandemic, and even probably before the pandemic, we were seeing how much more can be done, how much more needs to be done. So with Stacy and Dr. McQueen's leadership have really changed the focus of the behavioral health services, trying to be more targeted, trying to offer more expansive services.
Dr. McQueen is in the process of putting in place programs that include partial hospitalization. So when people don't need to be hospitalized, but yet they can't adequately be taken care of in the outpatient setting, a partial hospitalization program where you spend part of the day in a hospital setting is something that is really very much needed in this area.
Some of the other services that we have here as well are inpatient adolescent services. We do inpatient detox for adolescents and adults as well. We also have outpatient addiction services where people will come Monday, Tuesday, Thursday, and Friday for groups for substance use.
One of the things we really look forward to is being a fully integrated health system. So if anybody is receiving care within ortho or oncology or primary care, that's one of the first areas we're really focusing on. We can really provide an integrated approach so that the psychiatric and mental health needs of individuals are being addressed within that other setting. So as Dr. McQueen continues to grow in this role, we really hope to expand that to everywhere throughout our health system.
Very excited that we will be opening next year a freestanding behavioral health emergency department that will be dedicated to people who are having behavioral health crises, who are in need of care, so they don't have to spend days sometimes in an acute emergency department waiting for a bed. They will have a dedicated, trained staff to help care for them.
As we continue to grow our mental health services, your contributions are critical. Some of the things that we're really looking at is adding mental health outpatient services, not only at a higher level, the day treatment model, but really those general outpatient services that anybody can benefit from. We hope to offer those in a virtual component so that folks don't need to come here. We know that there is still some stigma associated with mental health, and I think we're breaking down those barriers one day at a time, and having conversations like this are so important. But thanks to all of you and your contributions, we're really hoping to continue to grow our services.